Migraines can affect your physical and mental well-being. Painful and unpredictable flare-ups can lead to feelings of isolation, anxiety, even depression. Migraines' impact on mental health is part of the reason that this neurological disorder is the #2 cause of disability worldwide. But how can you take steps to manage your migraine and your mental health at the same time? So Dr. Cynthia Armand is here with me again in Studio 57. She's a neurologist and headache specialist at Montefiore Medical Center in the Bronx. Welcome back.
Thank you.
Last time you were here, we were talking about different types of migraines, and they don't always look the way you think they're going to look. And when I started reading about the impact on mental health, it made a lot of sense. I mean, you want to be away from people. A friend of mine talked about having to literally be in a dark closet.
Right.
And that means, it's having an impact on your family, your interactions with loved ones. Can we talk about the connection between mental health, depression, and migraines?
Right, exactly. And it's exactly what you said. Migraine is the second leading cause of years lived with disability worldwide.
That's stunning to me.
And what that means that essentially people are living with this unpredictable, invisible disability that prevents them from living life to the fullest. So naturally, they develop feelings of sadness, depression, anxiety, and they isolate themselves. And sometimes that might not be the case where the cause and effect is not there. People with depression and anxiety may not develop migraine or may have that long before their migraine diagnosis. And sometimes there are forms of migraine in which individuals don't develop depression or anxiety. So it's really important to understand that. And as healthcare providers, it's not uncommon for us to encounter individuals dealing with mental health disorders affiliated with their migraine disease.
At times you have to physically isolate yourself. So I can understand how you would feel isolated. Emotional isolation, though, comes in all kinds of different ways. And we were just talking about how, sometimes when you're dealing with a chronic illness, initially people can be sympathetic. But after a while, sometimes they lose their patience. Can you talk to me about the emotional isolation, like convincing other people that, yes, I am this ill?
Yeah, so a lot of my patients find that they spend the majority of their time convincing people that they're really disabled, that they're really experiencing something that is a disease. And it can be so exhausting. So essentially they isolate themselves. And I tell my patients, you know what? Social connectedness is essential for overall well-being and health. And migraine does not define who you are as a human being. It doesn't define your health. So it's really important to maintain that connectedness. I tell them to talk to their loved ones about it. Bring your loved ones to your appointments. Have the doctor explain what you're going through and what you're experiencing. And then some people might find that their loved ones get interested in it, and they even help them during attacks. They bring their cozy blanket, they give them an ice pack. And so they're really taking part in their care. If they don't have loved ones involved, join a support group. So I have people have that shared connectedness in that space.
Yeah.
I also have them talk to their doctors, all of their doctors, to know that they have migraine disease, because migraine is a multidisciplinary disease. You want all providers understanding what it is and being involved. So that's really important as well. And the last thing, tackle the source. Tackle the feeling of isolation, the feeling of sadness. And the best way to do that, one of the ways to do that, but I think it's the best, is through mindfulness practice.
I tell you, it comes up over and over again, meditation, mindfulness, however if you haven't tried it, try it, because there's a physical change in your body when you are sort of quiet and focused. Dr. Cynthia Armand, maybe we'll talk about that some more, but gotta let you go. Thank you so much.
Thanks for having me again.
This program is brought to you in part by Ubrelvy.